let's go back to the Eastern Cape for that provincial government briefing on the latest on COVID-19. The Health MEC is now speaking. Let's go there live.
On and how they are carried. So we've agreed in the last meeting that as we sign those, we shall now engage on a communication strategy, because we found that sending documentation does not necessarily mean people understand. The other issue that we're looking at is that if you go back to what the Premier spoke about, the condition of our hospitals in the province, you'll find that majority of them were not designed to stand the test of COVID. We've now engaged AFROX in view of the shortage of oxygen to actually deal with piping in hospitals, in particular in major hospitals, so that we can be able to deal with the issue of the demand of oxygen in those hospitals. Premier, whilst we all understand that COVID has come to find us in this situation, we're also mindful of the fact that COVID has not taken away the work of the department that has done. So issues of primary health care are actually moving simultaneously with the work of COVID, because COVID would not have hit us the way it is if our primary health care was ready and 100%. We want, Premier, to stand here as the department to speak to the enormous assistance that we're getting from partners, from business people, from countries that are assisting the department. And in particular, the issue of PPEs. Because as the province, we're no more in the area of demand and high demand of PPEs that we've been suffering from. And secondly, the fact that we have got high numbers are a contribution equally of other partners like Pelo Pepper, who have actually come on board, and they have done a job starting from Amatole to OR Tambo to assist us in ensuring that we're able to root out COVID in our areas. Numbers can be high, Premier. Our worry is only those that really pass on. And that they are passing on. If they were not passing on, I do want to believe that we would stand here and want to believe that the more we get them out, the more we're rooting out COVID. But we're worried about those that are passing on. The other issue that is here is the whole issue of us having to mention the support we're getting from partners. It is quite important that we see municipalities get on board. I'm sitting there, Premier, and I'm just called by Buffalo City Municipality, a second municipality, to come on board, that they've organized from their China partnership some PPEs, and they would want to donate that to the Department of Health, precisely because we're doing the work. One of the issues that I want to talk to is the whole issue of cooperation and cohesiveness in terms of the whole issue of COVID. The partnerships that are within the departments are quite important, and I do want to believe that they shall help us. Secondly, the fact that we've got deployments from World Health Organization for the Department of Health to deal with the issues where we don't have much strategists who are actually now in the department and working. We've depleted the number of senior staff that have been at the head office. They are all deployed to districts so that they strengthen the management of districts where they are. And secondly, Premier, I agree, we've employed over 7,000 members to actually deal with COVID. But the issue of our staff members that keep being infected does suggest to us that we have to look at a strategy that is able to augment staff without going down. We're therefore, again, I add on the Premier, appealing to our members, to our people, whilst we understand it is very difficult to stay at home, to always be careful, to always wear our masks in the public, to always be sure that the rest that we're doing is about natural and everyday hygiene. That then suggests that primary health care is quite critical for the department to succeed in the issues The next Premier that I want to talk to is the whole issue that as the department led by the Premier, we have chosen to speak to improving our facilities. So COVID itself might not be a good thing, but it has given us an opportunity to improve our facilities towards NHI, and for us, therefore, to be ready for universal health care. I want to thank Premier this opportunity. Thank you very much.
So this is how we're now going to do it. We'll have MEC gather, and then we'll open the floor for questions. So you can ask questions to all MECs that are here.
Thanks, Premier, MECs, officials of the provincial government and media houses. Okokuqala, Premier, manditsho okokuba we operate on conditions not of our own choosing. We have to be alert of the circumstances that confront us from day one, and be able to be flexible enough to reconsider certain decisions. The statistics that we have as a sector of the Department of Education, which we receive from the Department of Health from time to time, requires a reconsideration of certain decisions that have been taken by the sector generally. We have come to realize, unfortunately, Premier, that we must answer one question: whether are we managing the infection and COVID as our strategic task, or are we managing the pedagogy of effective teaching and learning as a sector? And having answered that question, it then requires a serious detour from the sector at a national level on how to best manage the space, as I'm indicating now, that we are becoming more of managing the infection than dealing with the issue and content of what constitute the Department of Education. Hence, to reaffirm what the Premier has just said, that there is a need of a discussion at a national level to reconsider the phasing in of other grades that were scheduled for the 6th of July for strategic reasons, because from where we are seated now as a department in the province, our institutions, through the high and the rate of infections across the villages where our institutions are, we are becoming more saturated. It is unfortunate, Premier, that we have registered now 26 deaths as a sector. The majority of them are educators, which some of them has got underlying conditions, as per the reports that we got, and also the non-teaching staff. And I think it is going to be important that as we are experiencing outbreaks, moving from the Makaula incident, and how it has put the provincial government into a corner in terms of the infections across, it then becomes imperative that we must report that would make a plea and a call that out of the 105 learners that escaped in that incident, 16 of them has been tested positive. And we are busy trying to reconnect with the families to recall them back so that we don't become part of the statistics that, as a sector, are aggravating the infection in the province because of that problem of Makaula and the escape that we have experienced in the province into that Makaula issue. We have developed a plan of psychosocial services. As I have indicated, that would have to find a collaborative framework with the key strategic departments, your Department of Health, your Department of Social Services, your Department of Public Works, and your Department of Social Development. We are currently engaged on that, but what is transpiring is that if we don't have to snip on the bud, the infections around the schools, the infections around the institutions, as have been identified and indicated by the Premier, we are likely to register more infections and we are likely to register more deaths. And hence it is going to be strategic for us to contain and retain the current grades that has been faced in grade 7 and grade 12. If we agree with the national ministry. Because remember, the issue of the national calendar and the issue of what should happen in the sector is a matter that must be discussed in the CEM and later be subjected into the scrutiny of the national command in the country. That's how far we have gone, Premier. I think we'll entertain questions further in terms of the logistics and other related matters. Thanks.
Thank you. Can we take questions? We'll start with people that are here and then go to the WhatsApp group and those that can ask questions on Teams. Okay. Navan. Cheers. Okay. Askalan. Cheers. Che. Ufaka emgqobeni ixesha elide. Buza umbuzo ngazo. Ufaka into emgqobeni ixesha elide.
Thank you. Aviwem Dila from ENCA. I just want to quickly, MEC, thank you. Just on those 26 states, you mentioned the majority are educators. How many are of them? Can you give us the exact numbers of exactly how many educators and any learners possible? Also on the incident that we saw yesterday, I see Dr. Mbengashe is here. He did promise ENCA to give an update on exactly what happened yesterday. So I'm hoping Dr. Mbengashe can give us that exact update on exactly how those kids got to the freeway. But just more broadly on that, we've received a number of complaints of tests that have taken a month to come back. I mean, there was one EMS personnel who told us that he got his confirmation, Premier, after a month that he was positive. That's a EMS personnel that was working throughout that time. What's the delay in these tests in terms of them coming back? What's the hiccup? I mean, we saw one incident yesterday. So what's the hiccup in there? And then just maybe, we've also received a number of complaints in terms of the health system as a whole. We've received a number of complaints from doctors, from nurses, in terms of what's happening in those hospitals. Doctors staying away, nurses staying away, health patients are fighting among each other for some of those facilities, oxygens, for example. And you did mention, Premier, that the system is about to escalate. The COVID-19 pandemic is about to escalate. Is the province ready for the escalation? What are your plans for those? I mean, the health system is collapsing at this very moment. What are your plans around that?
Okay.
enkosi kakhulu uSithandwa Velaphi from Isolezo leXhosa newspaper. Ndicela ubuza okokuqala apha ku-Premier. Premier ngelishwa sibone amagama wabantu kule incident yabantu batestileyo and then from different hospitals. Ngelishwa we've seen amagama wabo kwi-social media. What would you say umuntu onokhalaza about ubona kwegama lakhe which goes kwinto esidima sakhe? And also ngicela ubuza pha ku-MEC ugade ubana mhlambi when can we expect like nje bethela uba kuzaba kwi-consultation with the national ministry le-basic education singalindela uba mhlambi bangabuyela nini kubantu bephondo to say mhlawumbe zeziphi grades ezizawuvula or not? Enkosi.
Okay. Anyone wants to ask a question here on Teams? Okay. Premier, you have the question from New Frame, from Anna, and the questions from the Sunday Times. So I'll ask the MECs to please respond to the questions that have been asked and the ones that have been shared from New Frame and from Anna. If you could please come forward for you to answer. Thank you.
Can I ask the time to take
the
Good morning, Premier. Good morning, colleagues. I spoke to an ENCA yesterday about the specimens that were found along the road. What was very disturbing was that these specimens were found and they were never supposed to be there. And of course, there were names of people onto the specimen. When I spoke to him, I did communicate to him that I was speaking to the local manager for the National Laboratory Services. I subsequently spoke to the CEO of the National Laboratory Services, and at the time when I was speaking to him that they had already collected the specimen. The initial investigation was that the courier system, which takes specimens between King Williamstown and East London to PE, they suspected that these specimens actually came out of that courier system, and therefore they were trying to establish exactly what actually happened. And then when I spoke to the CEO, she was also aware of this. But what's important was that they were going to do this, the investigation, and they now know what's going on, and they will be issuing a statement. And the reason why they should be issuing a statement because they are really the people who are very close to this, and it's a service that they already provide. So the National Laboratory Services will issue a statement in exactly what has actually happened.
What are they telling you, Dr. Menashe? What's the reason? Should we wait for a statement? Is that sufficient?
Yeah. What are they telling me is that they have actually looked and they have counted the specimen. They are assessing the quality of those specimens. They are assessing which one of those are still usable or anyone that have been damaged. And they've actually assured me that they will actually make sure that anyone who has been found to be in those specimens and their specimens that have actually been contaminated or damaged will be retested. And they will make sure that they make a formal communication with that. Now, we're very clear ourselves that the nature of this incident itself really tends to undermine our program to actually provide an assurance to communities that the tests that they do are actually contained and followed through, and they are making sure that they are used for the purpose that they were intended. It's an unfortunate incident. I don't have all the reason, exactly what happened to the courier, why those things were done, but that's the best that I could at this point in time. We just want to assure people that this is an incident that should not have happened, and this is an incident that should be totally, should actually be condemned. It shouldn't really happen, because even if there was an accident, someone should have really sat there, make sure that those specimens are collected. The reason why that is important, those specimens are called what is called biohazard. So they have a danger of actually infecting other person who could take it. And it's really quite an unfortunate. And it's something that we're going to be asking them to really strengthen their system, making sure that everything is kept in. We cannot create uncertainty about what happens to people when we're tested at this point in time. The second issue about the preparation for COVID at this point in time, there are really three basic issues that we do in order to really make sure that we are ready. One of them obviously is called the surveillance. We follow the numbers, we follow them very closely. The numbers tells us what is likely to happen going forward. The second one is that people will recall that we're in this particular state now because of the lockdown. The lockdown did what was very important to flatten the curve. Now, sometimes the issue of the flattening the curve is not clear. What really has happened is that the lockdown helped us to give time for us to prepare for the health services, so that the services is not overwhelmed by the number of people who are coming in. The post-lockdown, that is May and June, actually released those pressures, and these are the things that we're seeing with the numbers now. But even as those pressures are released, the numbers are not exactly as what would have happened if there was no intervention. We know on the modeling and the forecasting that the province is going to require about 10,000 beds to actually make sure that when the peak is very high, we're able to accommodate most of those people. And we need about 3,000 ICU beds in order for us to provide the level of ICU that's required. What we have done up to now, we have, in terms of our system, we've designed and planned, and we're in the process of building 8,000 additional field hospitals. We have worked, re-engineered, and repurposed our own hospitals to create another 2,000 hospitals. The models themselves, they think, and this is not me now, these are other models, they think that the way we are approaching this in terms of the capacities, we've made sufficient capacities. Where we are falling very short and we are great in danger is the ICU beds. But the latest development in terms of the technologies that are slowly coming up, we now have a better system of understanding what needs to be done and to make sure that patients are actually doing well. The reticulations of ordinary beds, it's a major technological advancement that will allow us not to really be reliant on ICU. Secondly, the provision of oxygen early is also a very important intervention that has been shown it actually works. Thirdly, there is now a medication that is really shown that people who are on ventilators, if they get the medications, they leave the ventilators early, and many people are actually surviving. We're bringing all those to overlay the system that we have so that the limits on the ICU beds are actually catered by that. So we know this is a very difficult epidemic. No country can adequately prepare. What is most important is how South Africans themselves use everything they do in order to prevent an infection. I think there's not much work done sufficiently for people to prevent. We can do and flatten the curve further by just making three basic things. The COVID is passed by person to person, and it actually requires three basic requirements. You've got to be within the person. You don't wear your mask, and you speak, you laugh, and you talk. That's what it wants. Secondly, you stay within 1 meter. That's the second thing that it wants. It wants an additional 15 minutes. If it can get that, you get the COVID. And that has been proven now by the most scientific work. So what we're asking people, social distance, wearing a mask, and not really interacting with many people. We think that can be really something that's going to help us to manage the healthcare services that are hugely constrained. Thank you. I think I've answered the question. Thank you.
Thank you once more. We have made our own submission to the minister in relation to the content by which the sector, we feel, should reconsider certain decisions. We have made that primarily because we have a scheduled CEM that is supposed to sit and discuss the phasing in of other grades on Thursday, the 2nd of July. So our view is that we can't have a one-size-fits-all. And our view is that if you have a current infrastructure challenge as espoused by the social distance requirement, and therefore also maintain the best ability to conduct the business of the sector in ensuring that there is a teacher-learner conduct as you advance the consolidation of the development of the human mind in the context of the learners. We have just made a comprehensive submission and alternative way out by which the country should be reconsidering those aspects. So we will bank our wisdom on that discussion that is going to unfold on the 2nd of July. Around the issue of the confirmed deaths, we have got two stats. We have got 25, not 26, 25, I'm sorry. 25 not yet confirmed, and we've got 50 that is confirmed as part of the stats from educators. You have got 8 that comes from the teachers, 4 that comes from the non-teaching staff, and 3, if not 5, that comes from educators. From the learners. So in essence, it means there is a dire need of ensuring that we care and ensure that from where we are now, we take more lessons and begin to review the strategy of government and ensure that as we marshal the current grades that have been phased in, we either camp them in one area so that they don't have contacts with the villagers, and in the process ensure that those ones that have not yet been phased in as per the legislation are kept there, and then the provincial government and the national government deal with them where they are. So that's the strategy that we are proposing to the minister, so that we don't find ourselves being at the center of as the epicenter of the COVID-19 as institutions of learning in the country, and also deals with some of the shortcomings that might arise out of that particular process. Thank you.
Thank you very much, Chair. Program Director once more. I think there are a lot of questions that are coming through the social media, also from the other media houses, particularly the electronic media. I think the questions from Sunday Times are too many. I think about the detail and all that, the infrastructure, the provision. I think we are going to make a formal submission to them as they are writing the article on this. I will leave it like that. Anna Majavu, the investigation at the Department of Transport will be done by our provincial treasury forensic team, and that is being handled at that level. So it will be done, and when that report is done, it will be publicized. It's going to be made available to everyone, so it's not an issue that it will just disappear, as we have committed publicly on it. We trying our level best to address these problems that are showing up every day. The issue of COVID, it's a very elastic, it's a very kind of a perennial. When you address this problem today, you wake up tomorrow with others, as cases are actually coming up and they're surging numbers. So we deal with different child problems every day. So it's an ongoing problem that we are handling on COVID-19. One thing that we are actually committing ourselves is to ensure that when that problem comes, it is attended to properly and it is dealt with. So the problem that you have is when you are unable to deal with that effectively. That's why we've been having this concern around the 100% tracing, which keeps us to have people whom we don't know where they are. We keep on looking for them and they keep on actually infecting other people elsewhere. That's why our plea that when you know, voluntarily come forward so that we deal with you as that case and assist you on the spot. But when people hide, run around, isolate themselves at home, we have a problem. That's why we said, Department of Health, whoever tests positive in the province, you know that with the National Health Laboratory Services and NICD. So let's really reconcile those stats so that we do our level best from a government side to reach out. I know others switch off their phones, run away. We had a situation like that at some point when we tested in PE. At night, when we were getting our results back at night, some people whom we tested with, immediately a person who was told, switch off the phone, and no one knew what to do. We were running around. So we really want people to be responsible around this, to understand that if you don't, you are basically doing a capable homicide, actually. You know, you are just killing people unintentionally. So we want to appeal to people to really not do what we are currently seeing out there. And sicela nabanye abantu aba bahlukane nobukula abantu. Sifuna ukunceda abantu eBhayi senze i-field quarantine by stadium. We are reporting 100% recovery. Bonke abantu asikwazileyo ukubathatha pha ezilokishini sabagcina pha bayawubona umahluko omkhulu. We've never lost a single life. So clearly, whether people have comorbidities or not, if sikwazile ukubafumana sayobabeka pha, siyakwazi ukubancedisa kangangoko. That's why ndithe ku-MEC wakwa-Health, MEC, let's try our level best. Siyayazi isigulo somntu yimfihlo yomntu ephakathi kwakhe nogqirha, awukwazi uyithetha ungomnye umntu. Kodwa sithe masisebenzisane nogqirha, private hospitals, private doctors, wonke umuntu sincedisane, because enye yengxaki esinayo apha e-Eastern Cape ukuswelekela kwabantu ezindlini. Kuba umuntu ebengazazi, ebengeka-testi, kuba abantu benezi-underlying. Sithi ke ngoku eke watesta positive, une-comorbidity, masikuncedise, mawuyo-isolatwa esibhedlele, kwenzela uba at any given time, even if you are asymptomatic, even if you awunazimpawu, you are not sick, ngela xesha uyawuthi unide ngalo i-oxygen okanye i-ventilator, ube within the reach, so that singabi nazo ezingxaki ze-ambulances nezinye imeko esihlangabezane nazo. Because the more this problem is getting into our communities, into our spaces, and our work, napha kwi-ambulances unalo ngxaki wonke umuntu, and sithe wonke umuntu makabe combat ready ngokokuba neyiphi imeko odilishana nayo yithathe ngokokuba yi-COVID-19. So le nto ye-PPE, people must always forever be ready on that, so that singathi sawutesta umuntu sibe nekhala lokokuba abantu bebemhendlishe njani. So sizama ukulumkisa ke nasemakhaya uba xa kukho umuntu ongathi unempawu zongaphili noba ngumkhuhlane nje, masingayithathi ngoba ngumkhuhlane nje, masilumke sikwazi ukuba sithule ukunyathela kulo meko njalo. Omnye umuntu othumele umyalezo ku Facebook uthi ezibhedlele kuloko kugcwele iqueues abantu abadala abayele esibhedlele yothatha amayeza. Uyabona ke ulamcimbi we-primary health education. Enye into esiyifundileyo ngale ngxaki sijongene nayo ye-COVID-19 njengoba sipreparishela ne-NHI program to be rolled out very soon. Siphawule into yokokuba akho nto yogqithe ukuthintela. Urhulumente akazibanayo imali eyoneleyo kunyanga kuba eke wamyeka umuntu wagula waya esibhedlele ufuna ibhedi, ufuna indawo, ufuna inesi, ufuna ugqirha, ufuna ioxygen, ufuna yonke. Kanti bangaba singazama kangangoko ukuthintela nokuqinisa amajoni emizimba abantu bakuthi bakwazi uba amajoni emizimba sincedise ukulwa nale ntsholongwane kuba bhetele kakhulu. So sithi ke bonke abantu abane-comorbidities siyicela ba-isolate esibhedlele because we have lost a couple of people abadala kuba bekuthiwa umuntu akaguli akananto ayivayo ewe uteste positive athi hayi bakuhlala apha endlini. So siyabacela abantu wawuyazi uba nguwe nozazi uba imeko yakho yempilo enjani, iza ngaphambili ukwenzela uba singasokwa yiloo nto kuba apha e-Eastern Cape sisenabantu abaswelekele ezindlini. Umhlala ezolo umuntu asuka amincwe nje ngokukhawuleza ithi ambulance ifika ngakumbi ezilalini ifike umuntu seswelekile. Phaya ke kwaba basesibhedlele nami le experience ndibone ngawo amehlo phaya engqamako. Fike abantu bebaninzi befole phandle kubanda abantu abadala xa ndibabuza hayi sizothatha yilelanga lethu le-appointment sizothatha amayeza befana bakho njalo. Zikhona ii-systems zikarhulumente zokudelivarisha amayeza sinabo nomakhaya njalo njalo. That's why the concept of motorbikes came into picture. Okokuba kube kwindlela yokudistributwa amayeza phaya ezilalini abantu banganyanzeleki babeze esibhedlele. Xa sele umuntu esazi uba ukwi-3 months treatment makamane eselwa i-treatment yakhe ngokwendlela urhulumente ayicwangcise ngayo engadanga wabe uya ngenyawo physical ayofika esibhedlele. So ukuncedisa noomakhaya abahamba indlela ezinde emakhayeni besokola beqokelela amayeza kwii-clinics phaya ezilalini. Iilali ezininzi zi-20 kilometers and far as clinics. Funeka uyazi uba une-15 rand yonke uze ukwazi uyothatha amayeza akho. Ayinoba kanti irayithi xa lolo hlobo xa ngaba sisithi ezempilo lilungelo labantu elikumgaqosiselo. So sijonge ezo meko zinjalo ukulungisa besicwangcisa njalo phambi koba kufike i-COVID-19. Sanyanzeleka siguqule iiplans zethu sijongane ne-COVID-19 ngaxeshanye si-adresse some of these chronic problems that have been in the system. Yona masivume that is an open secret that challenges esinazo, we have said that before, are systemic ingakumbi in the health space, particularly in our health department. And they will take us time to get to the bottom of them and resolve them and have this kind of a department that would want to see moving forward. And we are attending to that. We are addressing those problems. We are pulling now, as I'm speaking, teams that must get into that department from Treasury and other experienced former head of departments to come and work with us to ensure that we are able to sort out problems. And because we have seen it, even though we are dealing with disaster, it's life as usual. We're changing that mentality. We're trying to inculcate a new culture so that we are all in government to serve our people. And this time around, you need that agile state, that agility of government to respond to problems. So I'm noting all these questions. We've got work cut out. We are actually hard at work. We've got sleepless nights. We are trying to sort out problems. Kodwa sithi indlela elula engafuni yonke le nto isibangela uba sithi run around like headless chicken. Ukuba nje sizame ukunqanda ukosuleleka kwabantu. Uba singakwazi sonke singabantu beliphoto sithi kwanele ngoku apha kule yami household akho mntu uzawuphinda abe kanti uyahlakekisa. Asizubana abantu abasedolophini, asizubana abantu abahambayo nabantu abayabulanga singabaziva bathini kuba sithe u-social development bakaqokelele nabantu aba kuthiwa abanamakhaya bagcinwe kwindawo efanelekileyo. That's why siye saphawula ukuba akho mntu ungenakhaya aba besibaqokelele ezitratweni siye safumanisa uba banee-families banamakhaya sabalinka nee-families zabo ukuqinisekisa uba umntu uya-integratewa back and siyakwazi uqhubeka nobomi sibheke phambili. So lo msebenzi ke luxanduva urhulumente azipholisele lona kuba ungurhulumente wabantu senza kangangoko sinokwazi ukwenza uqinisekisa uba siyazi-adressa ezi problems. Yinyaniso emsulwa le meko yezikolo yi-decision endicinga into yokokuba isixakekisa kakhulu kuba kakade kungekho COVID-19 ubusika besibuhlonipha siboyika sibazi ingxaki yobusika izikolo bezivala. So ukuvula izikolo kanye ngepeak yewinter ikhona ingxaki naloo nto. That's a problem that we have, but ke kuba ii-decisions zezelizwe sinerhulumente omnye kuyanyanzeleka sisebenze within that national guidance, but we are making this plea to say in-provinces azizufana, and Eastern Cape has got a serious, huge social infrastructure backlog. Ayenziwanga yi-COVID. It has been there. That's why the program, a national, the province, also address all the mud schools, the erosion of the mud schools, building proper schools. That program is underway. That's why it's in the NHI, say pilot site as a province, to build a proper infrastructure, clinics in the province. It's simply because this province has got this historic, huge social infrastructure backlog. Whether it's clinic in Esbendel, whether it's called, and we're building these good hospitals. We've built Makiwane 1.2 billion, etc. So we're building this good hospital to address a huge historic problem. And this has been a chronic problem in our health system. So the challenge is to shana na yole. Mfoka velaphi. Akukho mntu onozayithanda laa nto. That's why ndifuna uma apha egameni karhulumente noba ngu-National Health Laboratory Service noba ngubani sicele uxolo ngala incident eyenzekileyo. It is completely wrong. It is unacceptable. Actually, it dehumanizes our people. Naloo nto kuba kubekho nabakwazi uyithatha bayifake kwi-social ibonakalisa i-society egulayo. Kuba akukho mntu onormal ozawuthi xa ebona into enjeya ayithatha ayifake kwi-social media eyazi into yokokuba zii-particulars zomntu ezi and isigulo somntu siyimfihlo. So yimeko yokokuba siphila ke kule meko yokokuba wonke umntu excited, wonke umntu uyi-journalist, wonke umntu unefowuni, wonke umntu unecamera, apha afike khona uyafota uyaxhoma, and akho mntu responsible, no one takes responsibility. Amagama abantu kudlalwa ngabo, akho mntu unesazela ngento ayenzayo. So siyabacela abantu bakuthi noko imeko ezinjengezi azikho mgaqweni. Really we condemn that what happened, and that's why sifuna sinikwe impendulo ecacileyo okokuba le courier xa ilisuke ekomani yathatha ii-samples zebhisho isiye emonti izawuye ebhayi ivulwe intoni apha endleleni, ivulwe intoni xa bekuthini. So it can't be. So ikubonakalisa i-element ye-negligence kubantu abanikwe umsebenzi sensitive wokujonga iimfihlo zabantu. So we can't accept that. It just can't happen. It can't repeat itself. So we definitely want to make sure that people are answerable to that, and those who are involved, they tell us. When we were orientated about all this testing and sampling in the laboratories, this specimen sakho ufakwa kula plastic bag ifakwe ebhokisini evalwayo ukuba zithi sako la hlobo sezingekho nakulo bhokisi bekwenziwe ntoni from that lab ebezithathwa kuyo. So there are a lot of questions. That's why we say leave it, get investigation done properly so that we are able. But it just can't be that it's about recklessness, and that portrays government as if it's a government that doesn't care. So it's something that has got nothing to do with how government does things, and people know exactly, professional and otherwise, how they must behave in that particular space. So that's why because imgqwalisa kakuba urhulumente wase-Eastern Cape nee-challenges anazo. So whoever works in government, he must or she must understand into yokokuba unoxanduva olukhulu nokuyikhuriya uba kulayisha izinto zabantu ezisensitive uzawuyika into yabantu kwenzela uba uyise kulaa ndaba efamba uyisa kuyo ngexesha elifanelekileyo. So yonke le mibuzo esinoba sikwazi uyiphendula apha izawukwazi ulandeliswa iphendulwe ingakumbi leya actually ye-print media We will be able to make direct answers per departments so that as they write their articles are able to cover all our comments. I think I can leave it here now.
Nkosi Premier and MECs, we have come to the end. I think we'll now do one-on-one interviews. MECs are available for issues specific to the departments. So their communicators are also here if you want to request an interview before they go to another engagement. Thank you very much.